Once there was hope, and this is how I feel, that some of you may be familiar with the National Service Framework for Mental Health, a very old document which promised us standard 6, carers would be identified, and so on. And the big problem there was that mental health carers often were in secondary services before they were given any support. Standard 6 was given to the local authority. The local authority knew very little about mental health carers, and I didn't at that time weren't very close to the trust of the care support services to be spoken of. Then I thought, well, at that time I thought, they've obviously made balls up there, but now the Department of Health have rectified this because they've brought in developing services for carers and families of people with mental health, with mental illness. And this is what was said in the report. Specialists, as opposed to generic services, are more desirable and appropriate for carers of people with mental illness. The caring task has less emphasis on physical care and is likely to be focused on supervision, befriending, and at times, just at times, coping with the behaviour of the person supported. Thank you, yes. So then the triangle care came. If you look at the dates, there's a big gap between these. But the triangle care came out and it was really welcomed. As Julie pointed out, it was for inpatient care. And I asked myself now, 10 years on, did it promote itself beyond its capabilities? Different carers have different needs. Early intervention services, carers in EI services have different needs than secure services. And what is carer awareness training? What's it supposed to do? So those are the sort of things that made me think. Now, when we started to develop Secure Carers Toolkit, secure services are services that, where generally speaking, the patient has a mental illness, but they've also been in contact with criminal justice services. We looked at the 5-year forward view and we used the language, enable, empower, navigate systems, peer support. We recognised not only was there iatrogenic harm done to patients, but also to carers as well. So we thought about that quite clearly. When we looked at the exploring family and care involvement was a piece of research done by UCLAN. So we used the evidence that was there to actually develop the toolkit. And at that time, carers talked about, and I don't think it's just carers in secure services, I think I was overwhelmed by stress, I felt dreadfully guilty at the time, I felt I'd failed, I can't move on with my life, I'm anxious, I'm depressed, I'm frustrated, it's bleak, it's a real struggle. And I don't think that any carer in this room here can not identify with those words. So it's that sort of thing. We also looked at the code of practice, which one of the principles was empowerment and involvement. So, I've only put this slide up because I wanted you to understand the spirit of the process that we used. Over 100 carers were involved in developing the toolkit. It is online. This is it. It is also it's in hard copy, but it's also online. And for me, so important was validating not just their experience, but their perspective of the service being provided is crucial to change. And it was really important to empower carers to understand the system that their relatives are in, because they have to navigate it. They come across the ministry of justice, police, courts, so on and so forth. The key elements of the toolkit, we've done it so that it is in a pathway, so that each of the chapters are on admission or discharge or into courts or first arrested and so on. So that's the journey that as a carer we'd also take through the system. Then each of the chapters are divided into the key issues. We've got key issues, and this is really important because what carers who were involved in developing the toolkit wanted was they wanted their emotional needs recognised. They wanted people to understand the issues they faced. They were dealing with the police, they were dealing with the Ministry of Justice, they were dealing with secure services who were really 20 years behind the time, but it's a very dark side of the NHS. So they wanted people to know that. So one of the sections is about how carers feel, and that's based on the evidence that we have. And then we use the words what carers should expect, say, in inpatient care. And we use the word, we didn't think about standards, we wanted expect, we wanted to raise the expectations of carers. This is what you should expect. Not, this is the standard, this is what you should expect. You should be able to ask this. And then there's a section on resources, different resources that you can use to actually help support carers. And then there's good practice examples. And the good practice examples are good practice in secure services, and in each of the sections there's also a list of people, services who actually, this is what we're doing, but then there's a named contact. So what we really wanted to hope to achieve was that because commissioners, carers, providers and service users had all been involved in it, we wanted to try and get people talking. For commissioners, we wanted them, and I'm not going to read through all this, but they wanted, we wanted them to be able to talk to services about carers and to be able to reframe questions when they were talking to providers about carers. We wanted them to share good practice so that if a commissioner went into one service, they could share with another service when they went in. With providers, we wanted them again to think about the issues faced by carers. This was really crucial for carers. And then we suggested a day of learning when they looked at the expectations and developed a plan on how things could improve. I'm just picking out some of these because of the time. For carers, we wanted them to feel less isolated, because if you read the toolkit, you know how they feel. And that, in a sense, is validating their emotions. And certainly when I did the research that we use, I felt validating. It was really important that happened to us, the carers. We wanted to give them background information that gives knowledge and confidence. So if you go onto the toolkit online and they talk about the code of practice, you click on the code of practice and there it is. If it talks about the CPA, you click on the CPA and there's the Point of Health Guidance to CPA. So that you're hoping that you've got that background knowledge and you can actually go in and say, look, according to the toolkit, I clicked on the mental health code of practice and you should be doing this. And we wanted to encourage parents to gently challenge what was happening. And we wanted them to get more involved and to recognise that they have their own needs. And that, again, they have their own needs. Yes, you're constantly thinking about the person you care for, but you also have needs. And so the service users as well, they wanted to give them a sense of the journey that their relatives are on. And sometimes it's actually not all about you. There are people outside waiting for you, visiting, feeling quite alone and isolated. And lastly, the implementation of it. It's really important to understand if something like this happens, like the toolkit, where is it going to sit for it to be a good lever for change? And at the moment, because it's Secure Services commissioned by NHS England, the service specifications for each of the services, we have the Carers Toolkit in that. Those service specifications are overviewed by commissioners. It also sits with Royal College of Psychiatrists in their quality network, so that as I'm one of the family and friends reps, I can go around secure services across the country and I can say, oh, are you using the Carers Toolkit? What have you done so far? What's the practice? You know, what's changed as a result of it? Have you got a carers engagement plan? I can do that, and so can our patient reps. So when we were developing the Carers Toolkit, we wanted to know where it was going to sit. So therefore, and the next stage of that is we're now developing some training for secure services across the country. So it is possible. And I would love to go on about it, but I can't.